Beginning March 17 until April 13, the entire Luzon is under an enhanced community quarantine. A strict home quarantine will be observed in all households.
More than a year ago, a virus had struck the world unexpectedly, necessitated a shift in our day-to-day routine. From mask mandates to social distancing, from staying at home to limiting social gatherings, we were forced to embrace it all. And because of the many imposed restrictions outside, a huge reliance on technology and the internet took effect. Let us dive into the current conditions of the Philippines now that more than a year has passed since the outbreak of the COVID-19 pandemic. I am Marcel.
I am Minette.
I am Dana.
I am Angela.
I am Alicia.
I am Rachel.
And we are Project KILOS, Key for Innovations and Leaders for Optimum Solutions.
With the panic and fear elicited by COVID-19, the spread of another pandemic has materialized, the rise of the Infodemic. In other terms, the spread of fake news and false information circulating on the internet, which fools and scares innocent people to believing information that may cause more harm to everyone. Project KILOS aims to fight the spread of false information in order to protect the people from further harm.
According to a 2018 research survey done by Post Asia, 88% of the Filipinos who have access to the internet through social media are aware of fake news, and approximately 79% of them knows and considers fake news to be widespread on social media.
At the start of our project, we created a survey. A survey that will help us gather baseline information on public's awareness of fake news. We introduced two identical-looking infographics, which contains factual information and which one contains false information. In this picture, infographic A is the fake one. After disseminating our survey forms, there were a total of 110 respondents. The majority of them are female and are between 18 to 24 years old. 3 days later, having a total of 110 respondents, approximately 1/4 of our respondents got the wrong answer in the first infographic, and approximately 1/2 of the respondents got the wrong answer in the second infographic. We conclude that most of our respondents were able to detect fake information. However, almost half of our respondents did not recognize that second infographic contains the real information.
To combat the infodemic through technology-driven solutions, we introduce to you the Maharlika app that features correct COVID-19 related information here in the Philippines, which will be made available for Android and Apple users. Upon downloading the app, the users will be able to choose a preferred language ranging from English to different languages spoken here in the Philippines. Users will then create an account in order to store personal data. Once logged in, 3 distinct interfaces will pop up that houses correct and valid information. The source of the news and medical information will be from our partner organizations, which are Department of Health and Red Cross.
In the All About COVID-19 interface, there are different sections that include: number 1, current local, regional, national, and international news regarding COVID-19. For example, updates about the quarantine levels in the different areas of the Philippines. Number 2, up-to-date data of cases reported per day. And number 3 and 4, COVID-19 facts and prevention, which are science-based health information regarding the body's response to the exposure of COVID-19, steps to take when exposed to the virus, prevention tips and recommendations, as well as the available COVID-19 vaccines here in the Philippines. In the COVID-19 hotline interface, you can see 3 main directories that contain important contact information from different sectors around the country. This is to ensure that users who have inquiries have correct and easier access to appropriate contact information. Our first directory includes the Department of Health. Below it are the LGUs or the local government units COVID directories, wherein you can search for your local government and see the available contact information. We also want to incorporate interactive learning in the application. Therefore, we included a game around COVID-19 facts in which points can be converted into currencies which will be donated to specific organizational partners.
Upon the execution of the project, we plan to divide the test run for the application into 4 phases, which will give us time to properly observe the effect and the impact of the Maharlika app. In phase 1, the application will be tested by medical professionals and allied health students. In phase 2, it will be tested by the chosen village or barangay with a total of 20 to 50 families. Phase 3 will move into a larger population, a municipality. Phase 4, we will be going on a much larger scale, starting from the regional level up until we reach the national level. How do we know when to move up to the next phase? After a week of using the app, a questionnaire will be sent to the target population, where the respondents must indicate the areas of improvement or the areas to be modified for the app that will be suited in combating misinformation. The implementation will move up to the next phase when a 75% approval rate is achieved.
To sustain our application, we plan to accept and include a section of advertisements that may help in boosting our popularity. The additional income from the ads may help in maintaining and improving the application and help support our donation drive.
We used SWOT analysis to analyze the success of our project. For strength, we are a highly motivated, skillful, and knowledgeable team. Our application is a user-friendly app. We also strictly implement Privacy Act for users' protection, and we have reliable sources of information. Regarding the weakness, the application is not available offline and has poor influence. Opportunities include partnerships, improved operating system, and wide-range delivery system. Threats are more competition, applications with the same concepts and/or services, misinformation that continues to be believed, and hesitancy of individuals in downloading an unpopular application.
Our project has a 3-year plan with the mission of completely putting a stop to Infodemic. Assuming that this project will begin in 2021, before the start of 2022, we would have finalized our project, collaborated with our partners, launched our app and website, and completed the 4 phases of our project implementation. In the year 2022, we plan to make improvements and clean our application as well as monitor the status of our project. Year 2023 is set for more improvements such as adding more features to our app design, starting more partnerships from different sectors, and launching new projects that will benefit the people. Beyond 2023, our app will expand to other countries and ultimately become a globally used application.
This is the projected annual budget for the application. $50,000 is allocated for 5 segments of the application production. This includes application development, partnership, and maintenance and sustainability. The other sections are allocated for the labor costs and human resources, assuming that the app development will take up to 3 to 4 months, and for the application release that is projected for 3 years.
Our project gives us the opportunity to be one step closer to be safer and better for our families, friends, community, and to our fellow countrymen. Let's beat the challenges of this pandemic one step at a time.
Ending pandemic
Starts
Starts
Starts.
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 with a click.